Hi, I'm Dr. Kerry Topouzian, and you're watching Ask Dr. T. Today's question is in regards to low thyroid function. To start out, let's talk about a couple of common scenarios that I see. The first one is a teenager or a young woman that is on birth control pills. Now, she may be on this for acne, for PMS, for painful periods, abnormal periods. And a physician will put a patient like this on birth control pills. In about 6 months to a year, maybe it's a little bit longer, this same teenager starts getting depressed. She's having depression all the time. Ends up going back to their physician. Patient's evaluated, and then they're put on an antidepressant like Prozac. So what's this have to do with thyroid? Well, a lot of these symptoms that this teenager was having may be secondary to low thyroid function. The PMS, the acne, the abnormal periods. And so what happens is they get put on birth control pills, and those synthetic estrogens that the teenager is now on is going to make the thyroid function worse. So she's going to start having other symptoms like depression. And then unfortunately she gets put on a different medication. The way that we would treat this patient at the Center of Healthy Living is evaluate her thyroid, and if needed, put her on some bioidentical thyroid replacement therapy and take her off her antidepressant and take her off birth control. Another common scenario we'll see are patients that are older, 30s, 40s, 50s, that are just having a lot of fatigue, maybe some depression, maybe something that we call brain fog where you just can't think clearly. They may have insomnia, they may have low libido, muscle aches and pains, constipation, you name it, all signs of low thyroid function. And if the patient is fairly well educated, they may have gone on the internet and looked up some of these signs and symptoms, and then they go into their physician looking to see what's going on. Their physician will evaluate the patient, and what they'll usually do is they'll get a blood test, which is called a TSH, thyroid stimulating hormone. The test will come back normal, unfortunately, on a lot of these patients. And so at that point, you're in a situation, well, it's not thyroid, according to their physician. You're depressed, let's put you on antidepressant. You're having constipation, let's put you on Metamucil or some other medication to help you with that. Insomnia, put you on a sleeper. Your libido's bad, let's put you on Viagra or a drug similar to that. When in reality, this is just it's just one screening test that you can do for thyroid. The way that we test for thyroid, there's 3 different things that we actually do. We'll actually get a TSH, but we have 6 different lab tests that we'll get on a patient. The second thing we'll do is if you're having a lot of different signs and symptoms of low thyroid function, like some of the ones I mentioned, fatigue, depression, muscle aches and pain, dry skin, losing the outer parts of your eyebrow, PMS, abnormal periods, constipation, if you're having a lot of those symptoms, that's like a positive test for us. So unfortunately, that's like a strike against you. So we're going to just say those are like signs and symptoms, okay? That's number 2. The third thing we do is we'll get a basal body temperature on you, which is we have you take your body temperature first thing in the morning before you get out of bed. And you can use either an old shakedown thermometer or use a digital basal thermometer, which is a specific type of thermometer that you can get at most drugstores. And what that tells us that if you have a low body temperature, which would be anything less than 97.8, that's a sensitive test for low thyroid function, because your thyroid hormone pretty much controls your body temperature. So we'll put that down here too. Let's say basal body temperature. So let's say you come in, we do these 6 blood tests on you. Let's say they all come back normal still, but you've got all kinds of symptoms and you've got a low body temperature. Well, we'll still try you, or actually put you on a test dose of bioidentical or natural thyroid to see if your symptoms go away. Does the depression get better? Are you sleeping better at night? Are your periods normalized? Less fatigue, less brain fog, okay? And if you start feeling better, well then we leave you on thyroid, and then we'll periodically check your blood work and your body temperature. Now, how do we treat with thyroid? There's a few different ways that you can treat patients with thyroid. Let's go through some of that. But first thing what we're going to do is let's talk about how the thyroid gland works. If this is your thyroid gland up here, it naturally makes two hormones. One's called T4, and the other one's called T3, okay? And actually what happens is this hormone here is a weaker hormone. It makes the more potent hormone, which is T3. Now, just to add a couple things up here, I'm going to put an I up here, which stands for iodine. And this is a amino acid, which is called tyrosine, which are raw materials that your thyroid needs to make hormone. Now, some of you have probably heard of Synthroid or Levoxyl, which is this hormone right here. People that are taking this are only getting replacement out of two of their hormones that their body makes. And the philosophy of this is that, well, your body will naturally make the active hormone, which is true. But your body also naturally makes approximately 90% of this hormone right here, T4. It makes about 10% of this hormone. So what we do when we treat patients with thyroid is we'll have a compounding pharmacy, which is like the old-time apothecary, and there's a dozen of them throughout the area. We have them compound natural thyroid to the exact percentage that your body makes. And most people feel better with this combination. The other things that we'll do too, because there's a lot of other things that will affect the thyroid, is we may replace with certain supplements like iodine, tyrosine. Also, which is very important, is that B vitamins, we're getting down pretty low here. Selenium, which is a mineral, and also zinc are all needed to help this reaction go. So if you have low levels of these vitamins and minerals, then you may be having problems with your thyroid gland as well. Now, there's another product out there that you may or may not have heard of. It's called Armour Thyroid. There's also another one called Nature Thyroid, and it's not a bad medication. It's a combination of T4 and T3, but the only thing that's a little bit off with it is that it's in an 80 to 20% ratio, so it's not exactly what your body makes. Sometimes we'll put people on Armour Thyroid, but for the most part, we try to do this other combination that we were talking about. Now, let's just talk about what causes low thyroid function in the first place. You know, why is this happening to me? Well, actually, a lot of it can be hereditary. You're born with it. Just like people are born nearsighted and have to wear glasses, people are born with low thyroid function, and it's because your parents or one of your parents had it. Another cause for low thyroid function is if you don't have the raw materials that you need to make the system work correctly. Now, I'm going to add in here, too, vitamin A and vitamin D are also very important for your thyroid to function properly. Other things that will cause low thyroid function is something called Hashimoto's, which is an autoimmune disease where your immune system is actually attacking your thyroid gland. It's extremely common and is often missed because specific blood tests have to be done, common blood tests, but they have to be ordered for you to actually diagnose that problem. Some other things that will actually cause low thyroid function are if you eat a lot of soy and cruciferous vegetables, which are things like broccoli, cauliflower. I'm trying to think of the other ones, but actually the way you can tell a cruciferous vegetable is when you cut the stalk if it looks like a cross, because cruciferous, that's like cross. Those foods will actually hinder thyroid production, but you really have to eat a lot of it, like per se, if every meal you're eating some of those things. Also, another thing that will cause I'm going to put it up here, heavy metals, candida, which is yeast, and also environmental toxins. All these things will actually stop your body from naturally converting T4, which is your weaker hormone, to your stronger hormone. So is this alternative medicine, complementary medicine, holistic medicine? Would you call it voodoo or witchcraft? Or would you call it common sense medicine? I'm Dr. Kerry Tapuzzi, and this has been Ask Dr. T. Hi, my name is Dr. Kerry Tapuzian, and this is Ask Dr. T. Today's question is in regards to male menopause or andropause. Now, what is andropause or male menopause? It's basically decline in testosterone in men over time. It's very similar to what happens with women, but unfortunately or fortunately, it happens over a longer period of time, 10, 20, 30-year period, so it's not as noticeable in men. And let's talk about some of the symptoms, because what most men would think is a symptom would be just low libido. Let's go over here. These are some signs and symptoms that start out with, and one of the main ones is loss of energy, increased fatigue and tiredness, loss of drive and competitive edge. These are a lot of these things that you might not necessarily think of, and you may just associate these with old age, if you will. Loss of mental focus, stiffness and pain in muscles and joints, when you're getting up in the morning. Loss of muscle mass and increased in body fat. Okay. Loss of level of fitness, depression, mood changes, irritability. And last but not least is reduced libido. And as you're going to notice, this is on the bottom too, because a lot of times this is one of the last things to go. You may start having all these signs and symptoms up here, and then lastly it starts with libido. And there's really 4 areas with libido that I'm just going to talk about real quick. Decreased desire and fantasies, decreased morning erections. Someone else should be getting up before you're waking up in the morning. Decreased strength of erection, and decreased intensity of orgasms. All right? Now there's more. So let's just go to the second page just to try to reiterate some of these things. And when I read these, I'm usually thinking about, someone's job and the way that they're performing at the workplace. And these are all things that testosterone actually does and